Welcome. Watching this video will give you information that will help you to understand how to put on and remove hospital-provided personal protective equipment, or PPE. After watching, please let staff know if you have questions or need assistance. When you enter the hospital, you will be directed to sanitize your hands. To do this, place 1 to 2 pumps of hand sanitizer into the palm of your hand. Make sure you rub sanitizer on the back and front of your hands and between your fingers. Rub your hands together until sanitizer has fully dried, about 20 seconds. You will be given a hospital-issued face mask to wear during your visit. You must wear this mask while in the hospital. Home masks are not allowed. It is important that the mask covers your nose and mouth at all times. You must wear the face mask for your entire visit unless staff tells you otherwise. You may need to wear additional or different PPE to visit your loved one. This may include a gown, gloves, eye protection, and sometimes an N95 respirator instead of a face mask. The staff on the patient care unit will tell you if you need to wear additional PPE. They will also give you the PPE you need to wear before visiting your loved one. When you are instructed to wear a gown, gloves, and eye protection, follow these steps. Disinfect your hands with hand sanitizer. Rub until dry, about 20 seconds. Take the gown and unfold it fully. Put your arms through the sleeves of the gown. Place the gown over your head. Avoid touching the front of the hospital face mask with the gown. If the gown has thumb loops, slide your thumbs into them. If not, the cuffs of the gown should be at your wrist. Straighten out the gown so that it fully covers you both front and back, and tie the waist ties behind you. Next, you will put on the eye protection provided. If you wear glasses, the eye protection should be worn over them. Finally, you will put on gloves, making sure to pull them over the cuff of the gown. You are now ready to enter your loved one's room at the direction of the unit staff. If staff tell you that you need to wear an N95 respirator, you will put this on before you put on your eye protection and gloves. To do this, sanitize your hands, rub until dry, about 20 seconds. Remove the hospital-issued face mask using the straps. Avoid touching the outside of the mask. If you do touch the outside of the mask, sanitize your hands again. Follow staff directions for storage or disposal of the mask. Next, pick up the N95 respirator and cup it in your hand with the straps hanging down. Put your chin into the bottom of the respirator with the nose piece pointed up toward your nose. Hold the respirator in place on your face with one hand, and with your other hand, pull the top strap over your head so it rests high on the back of your head. Continue to hold the respirator firmly in place and pull the bottom strap over your head, positioning it around your neck below your ears. Mold the nosepiece of the respirator to the shape of your nose with your fingers, moving your fingers from the middle to the end of the metal nosepiece. Do not pinch the metal nosepiece. Once the N95 respirator is positioned, do your best not to touch the outside of it again. If you do, sanitize your hands again. Now, put on the eye protection provided. If you wear glasses, the eye protection should be worn over them. Put on gloves making sure to pull them over the cuff of the gown. Now you are ready to enter your loved one's room at the direction of the unit staff. Taking off the PPE correctly is just as important as putting it on correctly. Gown and gloves should be removed prior to exiting the patient's room. You should never enter the hallway or walk around the facility in a gown and gloves. Remove your gown and gloves together in this way. Grab the gown material on both sides of your waist and pull forward quickly. This will cause the ties around your waist to break. If the first pull does not work, give a second quick pull. Now, move your hands to your upper chest area and pull the gown forward away from your neck. Using one gloved hand, pinch the glove and gown together at the cuff of the opposite hand. Slide the glove and sleeve off while pulling your hand out of the glove. This will turn the glove inside out as you are pulling your arm out of the sleeve. Touching the inside of the sleeve only, fold the gown over the opposite arm. Then, using your ungloved hand, slide a finger inside the opposite sleeve and glove and slide that glove and cuff off, touching only the inside of the glove and gown with your bare hands. Continue to roll the gown and gloves into a ball, touching only the inside while moving them away from your body. Hold them away from your body and throw them away in a waste container in or just outside the room. Never walk outside the room wearing gown and gloves. After removing your gown and gloves, sanitize your hands. Remove your eye protection and follow staff directions for storage or disposal of eye protection. Sanitize your hands again. Rub until dry, about 20 seconds. If you are wearing a hospital-issued face mask, keep it in place until you leave the hospital. If you are wearing an N95 respirator, remove it this way. Lean forward, grasp the bottom strap and slowly lift it up and pull it over your head. Grasp the top strap and lift it over your head in a forward motion away from your face. Throw away the N95 respirator in a waste container. Sanitize your hands. Again, rub until dry, about 20 seconds. Put your hospital-issued face mask back on. Pick it up by the straps and place them over your ears. Make sure it covers your nose and mouth. Sanitize your hands after touching the mask. Continue to wear the hospital-issued face mask until you leave the hospital. You have just watched the steps for putting on and taking off the PPE you need to wear while visiting your loved one. It is important to follow these steps in order to keep you and others safe. Please let staff know if you have questions or need assistance.